The importance of an abnormal foot X-ray. The importance of an abnormal foot X-ray. An abnormal foot X-ray is necessary when an injured foot is not healing properly. It may not be obvious at first, but it may lead to arthritis, poor quality of life, and substantial morbidity. These X-rays are important for identifying a wide range of issues, from simple cuts to more serious conditions. The X-ray should be taken on 2 separate occasions and from 2 different views. The images should be repeated at least once if they do not reveal anything. A normal foot X-ray will reveal medial elements and the Lisfranc joint. It will show if a bone is broken or dislocated. It can also tell if a bone is healing properly. It can also be used to help plan surgery. The X-ray will also reveal tumors and cysts in the foot. It can also detect infections in the bones at a later stage. A foot X-ray is an important investigation in orthopedics. Using small doses of high-energy electromagnetic radiation to produce an image of the inside of the body, foot X-rays are safe for adults. They are not recommended for developing fetuses, so women should let their doctor know if they are expecting. It is important to note that a foot X-ray passes through the soft tissue of the foot, not through metal or bone. Different types of tissues absorb different amounts of radiation, resulting in various shades of black and white. An abnormal foot X-ray is useful for detecting broken bones or dislocated joints. It can help determine how well a bone is healing after surgery. An X-ray can help physicians plan and evaluate the success of surgeries. It can also detect tumors or cysts that may be in the feet or bones. A routine foot X-ray will tell a doctor about the exact location of a tumor or cyst. The X-ray of a normal foot is characterized by the presence of the medial cuneiforms. The first toe is clearly visible. The other toes have normal alignment. The sesamoid bones are in yellow and orange, respectively. In both types of foot X-rays, the medial cuneiforms are well visible. The joints in the metatarsophalangeal joint are well aligned. An abnormal foot X-ray shows a fractured foot. The distal portion of the first toe is missing. The proximal cuneiforms and first metatarsophalangeal joint are well aligned. There is no evidence of any other foot problems. The X-ray will reveal the extent of any injuries. The abnormal foot X-ray is a useful diagnostic tool. The X-ray of a foot is a useful tool for the diagnosis of orthopedic foot diseases. They are also important for therapeutic planning and control. An abnormal foot X-ray may reveal growth disturbances, displacement of the tarsus, or luxations of the first toe. These X-rays can also confirm skeletal deformities. The X-ray of a foot should not be interpreted by an orthopedist. The X-ray of the foot is an excellent diagnostic tool. It helps diagnose various symptoms, including fractures and dislocations. It can also determine if a patient has fractured bones or an infection in their feet. The X-ray can be a useful tool in planning a surgical procedure and monitoring the progress of the recovery. However, a foot X-ray may also identify tumors or cysts, which are not visible without a doctor's examination. An X-ray image of the foot is one of the most important investigations in orthopedics. It can reveal a number of problems, from broken bones to dislocated joints. An abnormal foot X-ray can also help determine the proper alignment of the bones and whether a patient is healing properly. During a surgical procedure, it can help the physician plan the surgery. It can also detect a tumor or cyst in the foot. It can be helpful to determine if a patient has an abnormal foot. If the foot is pronated or overpronated, an X-ray can help determine the cause and treatment. A X-ray can help to diagnose a child's problem or a doctor's diagnosis. If the X-ray is normal, it is a good sign of normal growth. A patient's growth rate and joint alignment can be assessed with a gamma ray. Normal foot X-ray, normal foot X-ray, normal foot X-ray.